All right, friends. So if you are here, you have downloaded the Mental Health Starter Kit. You have hopefully paged through it. You've gotten one video from me so far. That's a bit of an explanation as to why I created the how-to guide. And today I'm going to break down the four categories of fit a little bit more, starting with directiveness. When we're thinking about directiveness, what we're actually talking about is how the therapist shows up in the session. You can think about that on a spectrum. And on the low end of the spectrum, low directiveness, you have a therapist who doesn't really create a ton of structure. You might come into the session and they might kind of sit there and just kind of nod and say, and they might ask a couple questions like, how does that make you feel? But they're not going to provide a ton of structure to your session. So that's low directiveness. High directiveness is you walk into the session and the therapist is like, all right, we've got our four goals. We're going to talk about career today. We're going to talk about that situation that happened today, right? So a lot more guidance from the therapist. And when you're not bringing a ton of content, that therapist might be like, hey, we haven't talked about this in a while. Should we touch that? Right. So you've got the spectrum. Low, someone that's like a little bit more presence focused. High, someone that's a little bit more structure focused. And in the middle, you might have someone who can kind of collaborate with you. They can bring structure, or they might be okay with you guiding the session on and off, depending on what your needs are that day. So that's directiveness. That's number one. Number two is approach. And this is where we want to think about what the therapist is trained in. If you have already been to care before and you've been to just like a classic cognitive behavioral therapist, CBT therapist, that's like what most therapists are trained in. Um, as like a baseline talk therapy, you might be ready for something else, or you might at the very start like really want someone who's like trauma focused, or someone who is focused on a specific issue and is trained in a specific protocol. So there's specific ways to address things like various disordered eating. OCD, bipolar disorders, things like that. So depending on what issue you're coming in with, you may already know that there's a specific approach you need. With trauma, often that's like EMDR, somatic therapy, right? Uh, Approach focuses on both the clinician's training, right? What are they talking about in their bio? And this is what people mostly discuss in their bios on like Psychology Today. But two is you also want to know, how is the therapist showing up in session in terms of their focus on the content? So are they okay kind of focusing on past experiences? Are they really focused on future experiences? Is it present day experiences? So that's another thing that you might want to ask when you do a consultation with someone. And then moving into the other two factors that are helpful, but not as key as the first two. The next factor is, the setup of the session. So are you going to be telehealth? Are you going to be in person? Those are really the main two. Most therapists do 50 to 60-minute sessions. That's pretty standard, although sometimes sessions can be longer, like for couples, relationship counseling, family-based counseling. But if you're doing one-on-one counseling, it's mostly going to be 50 to 60-minute sessions and either telehealth or in person. So you may already know the answer to that. You might not want to do a video session, or you may only really want to do video. You might not want to have to commute somewhere, go somewhere in person, right? It just sort of depends on what you're looking for. So that's three factors. And then the fourth factor is fee structures, right? So um, this is where people get really, really exasperated and exhausted because therapy can be really expensive. And if you don't have access to abundant resources to spend on therapy, it can be a real challenge to find someone who is accessible to you and has all the other three factors, right? So this is where I might say like, yes, and what you can afford is super important. It may even be number one, actually. But if you're seeking a really good fit, I'd encourage you to at least get the first two, right? So the therapist approach and then the therapist directiveness level, and then match that with fees and kind of forego whether they're virtual or in person, because really great therapy can be done over both modalities. Um, Okay, and then with fees, I could really get into this in the how-to guide. There's a ton of information in there explaining all the jargon, out of network, in network, super bill, deductible, things like that. But there's also actually a chart that explains like with different types of fees, what you're kind of giving up and what you're getting. So the benefits and the drawbacks, the pros and cons. So I really hope you take a look at that. I hope that was a good intro or a deeper intro to some of those factors. Please hit reply and reach out if you have specific questions, concerns about the guide, if you're curious about anything. And I hope that this resource is helpful to you.